Well, he says, no, that means you don't have, it means you do or you don't.
No, I agree. I would say it would mean that it would not mean, if you pass the stress test, it would not mean that you don't have Parkinson's.
All right, so what does it mean if you pass the stress test? It means you're not a candidate for bypass surgery. That's all it is. It's looking for patients to make money on. The same thing with mammograms. If you pass the mammogram, it doesn't mean you don't have a problem. It just means we can't make money on you yet. That's the way they set up all their tests. So a better test than a stress test, because you can have up to a 70% blockage in your coronary arteries and pass the stress test. So a better test is the ultra-fast CT scan of the heart, looking at calcifications in the coronary arteries. So you want to know, do you have more calcifications in your coronary arteries than someone your age, of your age and gender than expected? So you want to know, are you getting more disease or less disease? That's what you want to know. You don't want to be told, oh, you failed the stress test, now we can make money on you. Now I have a patient, you were talking to him the other day. He had bypass surgery a little over a year ago, and now he started developing some of the same symptoms he remembered getting a year ago before the bypass surgery, and now he signed up for chelation therapy. He said, I think he said, I don't know what he paid for his bypass surgery. He said, even if it's $50,000, he said even if it was free, he wouldn't go for bypass surgery again. In fact, it was free. His insurance covered everything. And so he's paying the $3,000 or so for the chelation therapy. And after a few treatments, his pain has disappeared now. Because we're addressing the underlying cause, getting rid of those toxins in his body that interfere with his body's ability to heal themselves. I mean, that's the key. Is what? His getting chelation, his angina is gone. So the key is remove the impediments to healing so the body can heal itself. I mean, that's what it's all about. If you go for bypass surgery, it doesn't mean you don't get better, but you have to understand what you're getting better from. The blockages that create the symptoms that are cured or addressed with bypass surgery are the ones that do not rupture and cause sudden death. Those are the mature plaque that is stable, but they've grown to the size that not enough blood is getting through to the heart. So yeah, you bypass it and you get relief of the symptoms, but it doesn't reduce your subsequent mortality from heart attacks, because you can still have a heart attack and still die. They don't matter. That's what I bother to mention. So I mentioned thermography, I mentioned chelation, I've mentioned, I haven't mentioned ONDAMED too much yet. We'll get to that now. And the ONDAMED, the chelation, the ultraviolet treatments. And so we come to ONDAMED. Now, interestingly, I don't know if you saw the poster in the back. I was in Suzanne Summers' book, Ageless. She printed that out about 3 or 4 years ago. And she contacted me, I think she saw my name as an advisor to Life Extension Foundation. I think that's where she found my name. So she called me up. It was funny. The front office girl comes to me and says, Suzanne Summers is on the phone. I said, come on, right? But I said, all right, I'll tell her to hold, I'll get on the phone, I'll take it. And basically what it was, she wanted to set up a time to interview me for the book. And we did at least an hour-long phone interviews before the book. And I had no idea if I'd turn up in the book or not until the book came out, and there I was. And I guess some of you have heard of Suzanne Summers, right? Anybody haven't heard of Suzanne Summers? Yeah. Her books are really good because she's not, even though she's taken some heat for writing those books, she's not promoting her own opinions or anything. She's interviewing doctors that are getting results in their alternative treatments, and that's what. And she came to that point because she got sick herself with breast cancer, and she went for alternatives, and she realized there's a whole other way of addressing problems, and not just mainstream medicine's way. And she found they were very effective. So the question we have to ask ourselves is, at least I ask myself this question. I'm not sure if you ask yourself this question, but what can you do? What do you have to do to stay healthy? You ever ask yourself that question? See, it's not. See, a lot of people ask themselves the question, "I'm sick. What do I do to get better?" But that's too late already. So you want to ask yourself, what are the risk factors to make me sick? What can I avoid? So I think we know a lot of this stuff, although it's become very difficult because nobody talks about it. We know we have to eat well, but we know we still can't get enough of the nutrients that we require, so we come to stores like this and we buy supplements, which is a good thing, because you can't get it from your diet anymore. But then we have a problem because we don't, we're exposed to all the toxins in the environment. What do we do about that? Well, you try and drink purified water. Some of you do chelation therapy. Chelation therapy is also very effective as a preventive treatment. You don't have to wait to get sick. You put air purifiers in your house, water purifiers. You exercise, hopefully. And exercise is very good, not just for the fact that it's going to give you strength and flexibility, hopefully improve your balance, but exercise is also going to relieve stress, because stress is a big killer. How many people in this room are under stress? Yeah, because you're worrying about something. I tell people, don't worry, it doesn't do any good anyway, right? So I know Suzanne Summers. I see her at the meetings once a year, because now at the American Academy of Anti-Aging Medicine, they like to have her lecture at least once a year there, because she's a great proponent of anti-aging medicine and just staying healthy. So one of the lectures, I happened to run into her doctor, Michael Gallitzer. He's in California. And because for a few years I've been looking at this equipment, this ONDAMED device, and at the shows, I don't know if you've probably been to some kind of, like the home show. You've been to the home show, maybe, down here? You see all the little booths? Well, that's how they have it at the medical conferences. You have the lectures, and then in between, you go to the big room and they have all the different companies showing different things, whether it be supplements or devices like this. Well, the booth they have is usually one of the biggest booths at the show, and all the chairs are taken because everybody wants to try it out. And Burton Goldberg, you know that name? Anybody know the Burton Goldberg? He says to me, he says, this is really good. Burton Goldberg looks pretty good for a guy in his 80s. He says, this is really good, this device. Of course, Suzanne Summers is using it, and Michael Gallitzer says how good it is. Now, it costs $25,000, so you got to really think twice about it. But I really want to help people, and I have to say, so we improve nutrition, we remove toxins, we can do the different treatments like ultraviolet treatments or chelation. But what are we doing to address the effects of abnormal frequencies that we're exposed to in the environment? So I brought a few things now. This is they call it a tri-field meter. It will look at magnetic radiation, electric radiation, and radio waves. I don't know if you can see this. Right now I have it turned off, so you can see that the arrow is at 0. I'm not sure what's going to happen now. So now I turned it on to magnetic in the 0 to 100 range. You can see the arrows moved a little bit. And if I were to hold it up closer to the lights, usually you see it's going up. Can you see that? Yeah. So you can see we're being bombarded by electromagnetic radiation. Let's see. That's now. See, now I have it on the more sensitive range, so you can see the arrows even higher. It's also magnetic, and then we have electric. Not getting too much electric here. And then radio, just a drop of radio waves in here.
How about the phone on your hip?
Well, we're going to do that now. Now, Stephen Sinatra, you heard of him, Dr. Stephen Sinatra?
He's from Manchester, Connecticut, isn't he?
I think he's from Connecticut, yeah, from
Manchester.
Right, and he's a cardiologist, and his lectures these days are about vibrational medicine, and in one of his lectures he brought this device in. And this is basically just picking up radiation in the environment. I don't know if anything, what it's going to pick up. That's it. So I brought these along just for demonstration purposes. These are called cell phones.
It's turned off.
It's turned off. Well, you don't hear anything now. Now I'm going to turn it on. And I did that. So you can see, so, all right, what do you think is happening then, right? When you put these devices next to your head. So,
Look at your brain.
and I think more and more information is coming about that there is an increased risk of cellular damage, brain tumor, based on duration of exposure to
How about these little things you put on to stop the radiation?
well, okay, now what those things do, I have one on this phone, by the way.
Oh, really?
You
I
see
got
it
one
on
on
the
my
back?
phone.
Now, what they're supposed to, if you look at an electromagnetic wave from a cell phone, you know, it'll go like this, like other waves, but there's a part of it about, they call it dirty energy, where it's not a clean wave, you have little, you know, I'm not sure how to explain it, and that's what those are supposed to do, sort of clean it up a little bit. So you'll still hear it, it'll still make noises on here, because it's still, you know, electromagnetic field being generated, and turn your phone on.
Yeah, it's on.
I'll break it up.
It's breaking it up a little.
Maybe make a phone, press,
That's fine enough.
Or somebody's-
some phones are worse than others. Let's
So
see.
you,
This was the iPhone, the first one.
more technical later on.
That's better.
What phones do too is they don't constantly stay connected, like they send out a pulse periodically. See, there it goes, it's sending out a, so
What about if you were like, you use it as a speakerphone?
that's better, because if you hold it close, you see, if you notice, when I held it like this, it didn't make the noise, but when I held it like this, it made a lot of noise.
So is the
Well, that's
Bluetooth the same thing as the phone?
They say the Bluetooth is not, is, even though you're putting that thing in your ear, it's not as bad. I still think speakerphone is probably the best. The wired connection is probably better than the Bluetooth.
I don't know either.
So the point of this demonstration was just to make you understand that we're being bombarded by electromagnetic fields that are interacting with our own body's electromagnetic fields. And you can't say they don't have any impact. They must have an impact. And it's very difficult it's a difficult concept to grasp, because you know you can't see it, you can't feel it. But I can tell you, a patient I had years ago, a retired physician, and he used to do fluoroscopy in his office. How many people remember what fluoroscopy is?